It's great to have you here. How are you, Anna? How are you, Antony? You're right.
Doing
Great,
well.
thank you.
Thanks, Rebecca. Thank you.
Good stuff. Now, we're going to talk about healthcare today. And I have to say, because I absolutely love the US and I go all the time, but the one thing that would worry me about moving there is the cost of healthcare and the sort of different system. Because obviously, we've got the National Health Service here and we don't have to pay for it. So for me, it's an interesting topic to see how it all works. So, how does it impact people and the economy as well? What do you think, Anthony?
I think you're absolutely right to worry about it, and I think a lot of people do. I kind of have a foot in both camps, coming from the UK originally, but living in the United States for the last 30 years. So I see both sides of how things have done, and it is a worry for a lot of people because the cost of healthcare definitely impacts how people think about their lives. It affects people's financial well-being, even their retirement. People lose their houses because of healthcare costs. It's so expensive here. Some private insurance plans cost upwards of $40,000 a year. And I'm not talking for some kind of ultra high level plan. It's just, a high end plan, but just it's so expensive. Now, a large portion of that cost is often paid by employers.
Right.
And so you end up with a situation with many people choosing which job they're going to take based on the type of healthcare coverage offered.
Okay, yeah, no, I can see that. So is that $40,000 for a family or for an individual?
That would be for a family, but still,
Right.
think that's such a a high amount.
No, it is. It's huge. My children really aren't worth that. No, that's absolutely shocking amount of money.
Yeah,
But it is very different in other countries. So, I mean, what are the different models and sort of how do the different countries work in comparison to the US?
Yeah, no, it's interesting how different countries around the world approach this because there's so many different type of approaches. And if you talk to people in different countries, there's no one who says, "Oh, we're really happy with the system." So certain systems sound good. Sometimes the grass sounds like it's greener, but oftentimes it's not. So if you think about like the UK, for instance, free national healthcare system in theory, right? So the government has higher taxes generally, but you can go to see a doctor for free. And in Scotland, even prescriptions are free. The flip side of that, oftentimes there's long wait times to get
Yes.
procedures done. So that's kind of the downside. Some other countries like Germany and France, I think, have a private funding model. So it is privately funded where employers and employees pay those premiums. And it's kind of through a mandatory payroll deduction. So it's almost similar to the US, but has subtle differences. And then in Canada, everything's paid through the government. So again, it's similar to the NHS in the UK where it's free. But the actual healthcare is provided through private organizations rather than through kind of non-profits and government sector. And then, of course, there's the uninsured model. We're fortunate from wealthy countries. Not every country has that type of healthcare structure. And in wealthy countries, there's also a lot of uninsured populations who don't have the luxury of an employer who's paying for coverage. And they're having to go to emergency rooms to get seen for normal day-to-day treatments.
Oh, I mean, that's absolutely true. But Anna, do you think the US system is a lot more complicated than others? I mean, just from the bits I've heard, it seems a very complicated system compared to other countries like, say, Spain or Germany.
Yeah, I believe so. I think, I mean, the healthcare system in the United States is quite complex and diverse itself. It primarily operates through a mix of public and private sectors. On the public side, we have major programs such as Medicare and Medicaid. Like Medicare provides coverage for people who are 65 years old or older, while Medicaid helps low-income individuals and families. So these programs are funded by the federal government, but are often managed by individual states, which can lead to differences in how they are run. So a lot of people that are on these programs, sometimes even relocate to see, depending on which state provides better solutions for them. In the private sector, most working age Americans, as it was mentioned already, get their health insurance through their employers. There are also private health insurance plans that are very expensive, that people can buy on their own, often through the health insurance marketplace. I would say that one of the key features of the U.S. Healthcare system is that is the emphasis on choice and competition. So patients often have the ability to choose their healthcare providers and insurance plans. This can drive innovations and improvements in care. However, it also means that the system can be quite fragmented, with significant differences in access, quality, and cost of care, depending on one's insurance status and also even location.
And I can see that. I mean, I'm interested that it is so expensive, as Antony was saying, with the average cost being as much as it is. So people are paying a lot of money for the care. Do you think that, despite everything you said about it can cause innovation and all those other things, do you think that the standard of care actually reflects the spend that people are putting into it in the US? I mean, what do you think, Antony?
I think the quality of care in the United States is very high. A lot of the hospitals have state-of-the-art equipment, they're beautiful buildings. And so I think that you do get excellent care, but I think it's very regionalized. And so you get some areas that have fantastic facilities, other areas that are perhaps in more inner city locations, they may not have as high quality treatment facilities. So there is some aspect there. But if you look at the stats, the US actually spends about twice as much per capita on healthcare than other countries. Back in 2022, US was spending about $12,500 per person if you take everyone, and that compares to like 8,000 in Germany, 5,000 in the UK, and even 4,000 in Italy. But so even though the US spends twice as much on healthcare, the outcomes are not good. And the United States actually ranks last out of all healthcare groups in the top 10 wealthy countries, right? You have to compare kind of apples to apples.
Yes. No,
and they perform last. So money doesn't buy results in many instances, and part of that is because the administrative behind the scenes component in the US is so huge. There's a massive bureaucracy in terms of once you see a physician or you have a procedure, that has to be coded up and it has to be invoiced, and it goes through this massively complicated system of billing and collections called revenue cycle management. And it really, the US spends 4 times as much on that administrative piece as other countries. And that means that not as much money is being spent on actual delivery of care.
Yeah, you think there might be a room for some AI in there, wouldn't you?
Yes,
if ever I heard a case for it. But Anna, can we actually look at the structure of the healthcare and sort of how it's delivered? And because there are sort of not-for-profit pieces, aren't there, within the healthcare system, and bits that go after profit. So could you explain how it's all structured and delivered, please?
Of course. So as you mentioned, I mean, the healthcare in the United States the structure is also quite complicated, but it mainly falls into 2 buckets, which is non-for-profit and for-profit healthcare organizations. It can be hospitals or practice groups. And the tax structure is also quite different for those. For-profit hospitals or healthcare organizations or practice, the hospitals those are owned by investors and operate much like any other business. So they are required to pay property and income taxes at the federal, state, and local levels. The primary goal of for-profit healthcare organizations is to generate profit, obviously, for their shareholders. This financial pressure often leads to strong emphasis on cost efficiency and operational discipline. And for non-for-profit hospitals or organizations, on the other hand, they are tax exempt. These, generally 60 to 70% of the U.S. hospitals are non-profit organizations. They do not pay federal, state, or local taxes or income or property taxes. Instead of distributing profits to shareholders, nonprofit hospitals reinvest any surplus revenue back into the operations, or they can, a lot of non-for-profit organizations sponsor or create these funds that will help the public. So they create these community health programs and other initiatives that benefit the public. Nonprofit hospitals are also accountable to their donors, community members, and their stakeholders to meet their mission and suffice the plan, basically.
Yeah. So it strikes me you've got this hugely competitive market, and it must be very cutthroat from what you've said. And then you've got these non-profit organisations that are trying to keep going, and trying to get income. So do they end up all getting into trouble for one reason or another, either because they can't compete or they can't get enough income to keep going with what they're doing if they're non-profit making? So what do you think, Hannah?
They are called non-for-profit organizations, but at the end of the day, they operate operationally. There's another type of business that they need to maintain and generate the income to fund all their activities, right? And within the non-for-profit organizations, there's also competition. There are also mergers. They merge. They take over one another, and obviously there's a competition within the non-for-profit as well as for-profit,
Right,
obviously.
okay.
And then really, let me just add to that, Rebecca.
Yes.
So it's really, we're not talking about you've got for-profit enterprises who are making tons of money and it's competitive with the non-profits who are more charity-based. There really isn't a for-profit healthcare space in the United States. It's really either provided by non-profit organizations or by state-run organizations.
Right.
So, but it doesn't suggest it is somewhat cutthroat because they are competing with each other, not necessarily to who can make the most money, but who can kind of survive in a very challenging environment. And so they're trying to entice local consumers to come to their facilities because they've got nicer buildings or a friendlier, more approachable staff. Those factors make a difference because it is about census and getting beds filled, even though it's a non-profit space in a healthcare where you wouldn't expect that to have any form of competition.
No, that makes sense. So it's very reputation based, isn't it? That's
very reputation based, yes.
And that goes for the doctors then as well as the actual facility, doesn't it?
Yep.
So Antony, if you were going into a hospital that was struggling, what would you suggest them to help them avoid closure? What were the starting points?
Yeah, it's interesting. The approach here is very much the same type of thing you'd see with any other kind of company, whether it's a manufacturing business or a retail industry. It's about continuous improvement and trying to make your business, I'll put that in inverted commas, as efficient as possible. So the kind of organizations that do the best are the ones that are constantly making changes. They're really looking at their numbers. And unfortunately, it's an aspect of healthcare, so it's not just focused on the clinical side of providing great healthcare to patients. It's about doing that in as efficient way as possible. So what they could do is hospitals that we work with, they track their clinicians' performance and they look at the profitability of each of their individual doctors, and they set targets. So it's
can you imagine that in the NHS?
Oh, can you believe it? Absolutely. It's like, this is how many patients you have to see on a per day basis. Now in the NHS, it's basically you've got a huge backlog, many months waiting list. The government's obviously talking about bringing more people in and providing more incentives for doctors. In the US, it's a requirement. The hospitals themselves will, if a physician's not performing to standards, because there's very good benchmark data available, they can see, well, for your type of service, you should be seeing X number of patients. You're not. Why is that happening? Is it because you're new to the practice and it takes time to build up? Or is it because you're lazy, right? And so hospitals have been known just to fire doctors, right? Get someone out who's just not performing, because doctors are well paid. So it's a high cost for the organization. And they have to be efficient. So it's about tracking that. It's about cutting costs, making sure you renegotiate your contracts, You're looking to diversify in areas that could generate more margin. You're looking to improve your cash flow, finding strategic partnerships with other hospitals in the area where you do some, they do some, and you kind of take the best of both worlds. You know, the nonprofits, as Anna said, they're looking to raise money as well. So it's not just about delivering services. Bringing in technology also can really help. New machines can generate a lot of money. The amount of money it costs to get an MRI here is just is crazy. And then there's M&A. So there are transactional components within the healthcare space, even though it's non-profit, and you see the influence of private equity. Amazingly, not something you'd.
That surprises me.
Yeah.
No, that's interesting. So Anna, you talked about that M&A piece just a little earlier. Is there a lot of M&A activity in the healthcare sector?
Absolutely. Yes, so the healthcare sector in the US has been seen significant M&A activities throughout many years now. And seeing, you know, and there was a little bit of slowdown in 2022 and 23, driven by different factors such as, you know, high inflation rate and increase in interest rates and regulatory scrutiny. Those factors previously slowed down a bit the M&A activity in the market, but I think, and we see from 2024 this year, we see an increase in M&A activities again.
Right. So are there a lot of big players in that marketplace? Are they buying up small operators, or is it just small organizations sort of merging and taking over each other? I mean, we talked about the private equity, but for private equity get involved, are they just coming in as on their own to invest in these businesses, as you put it, into these hospitals, etc.? So what's it look like?
So yes, I mean, there's a great consolidation going on in the healthcare sector. We see large players acquiring, merging, and also smaller players and on the private sector, like private equity groups trying to build like platforms focusing on certain industry sector, let's say dental or behavioral health or any other. So there's a lot of activity, a lot of consolidation, because the healthcare market itself is quite fragmented in the United States. Aside from the big hospital players, institutions, most of the healthcare space is managed by privately owned or private equity owned sectors and platforms and comparably smaller players. So there's a big activity, M&A activity going on.
So I was going to say that includes your sort of dental, eye care. When you talk about sort of people who are just privately owned, I presume that's where they would come in, or are they big providers that are doing dental? And of course, you've got the mental health piece as well, which has always been far more important in the US. I mean, we've taken a long time in the UK to catch up with our views on mental health. So how do they fit into all of that?
So in behavioral health, increased awareness of mental health and addiction issues, particularly after the pandemic, has led private equity and health system to invest more into that space, into mental health facilities, outpatient services, and telehealth platforms dedicated to behavioral health. So we see a lot of consolidation, a lot of mergers and acquisitions in that space, where private equity, as I mentioned, private equity groups are building large nationwide platforms focusing on behavioral health. And regarding the dental and vision care, also continue to be quite high in activities in M&A due to their predictable revenue streams and recurring patient visits. So these factors make them appealing for roll-ups that consolidate smaller practices under larger platform umbrella. Additionally, the regulatory and compliance requirements for dental and vision care are less strict in the United States compared to other healthcare sectors, making them more attractive for a long-term investment.
I can see that. So, Antony, I mean, we've got the NHS struggling here at the moment, and I think inevitably there's going to have to be some change, which I think is already organically happening, actually. We've had issues such as the pandemic that has really shaken healthcare systems everywhere. What do you see in the future that are trends similar to these things, that are healthcare trends that would be global, and how do you think the system will deal with those trends?
Oh, Rebecca, I think, the future is one of the most exciting areas for me, and it has the possibility of being transformational, especially because of this AI, right? Everyone's talking about AI these days, and it's certainly the hot topic. And in many instances, it's kind of a hope rather than expectation. But I think in healthcare, it can make a huge difference, and it's already started to make a huge difference. So I think there's a few areas that from kind of top to bottom of healthcare where it can really kind of kick in. So early disease detection is one, right? So you've got these AI algorithms that are now going through huge medical data to really identify patterns and anomalies and find ways to like get early detection. Because if you can find ways to detect diseases like cancer or heart disease early, you can actually have earlier intervention and much more improved patient outcomes. And it's not just a behind the scenes thing. I've also read about physicians and surgeons who are using AI actually in live surgeries. So for instance, with breast cancer surgery, they're going in to treat the patient, they're taking out the cancerous cells. They would then patch up the patient, test those cells, come back and say, well, there's still potentially more and have to have potentially a second surgery. Now they can actually do the testing live because of AI. And so during the surgery, they will say, yes, we need to take a little bit more out to make sure they get as much as possible and have the best chance of kind of an outcome, which is incredibly exciting.
Amazing, isn't it?
Right?
It really is.
So then we're all wearing these kind of remote devices, the Apple Watch, whatever they be.
Yeah, recording everything. Yeah.
Oh, absolutely. And so, but it's going to lead to that use of big data being able to be mined and utilized, not just on a kind of a community basis, but on an individual basis. Rebecca will have her information always uploaded. In theory, maybe there's even the point where your own doctor will get an alert saying there's certain things, you'll get a call, you'll come in for some tests. And again, it's all about that early detection to have better outcomes. Of course, there's the AI able to look at ways of accelerating kind of drug testing and discovery, because certainly in the US, the FDA approval understandably is very long. But if you can reduce that, then some of these really life-saving approaches and techniques can be put into play much earlier than otherwise would be if it's just researchers using old school methodologies. So those are kind of on the clinical sides, but we also mentioned earlier in the kind of the podcast about how AI could potentially help on the administrative side.
I was just about to ask you about
that.
So
yeah, because in the US, 25% of healthcare jobs are on that administrative, the coding, the claims, the insurance that I mentioned.
Ridiculous, isn't it? Imagine
it's crazy. And so AI, if you have systems, they can do appointment scheduling, claims processing, medical records management. It kind of frees up these resources to be redeployed back into the clinical side. So it's very, very exciting. Again, we're very early stages. But if you think of where we're going to be 5, 10, 20 years from now, it's going to be absolutely transformational.
Yeah, no, I think you're absolutely right. That's really interesting about the medical side of it. Anna, have you got anything that you want to add as a finishing comment on the future?
Well, there are a lot, as you both mentioned, I mean, there are a lot of factors that are impacting the healthcare market. AI is one, obviously, as Antony mentioned. Also, like different trends happening or different new, like let's say new treatment plan, new treatment solutions that come along. For example, now everyone is talking about this weight loss pills or weight loss shots, Ozempic and others. I mean, all those trends that most of them are dictated by probably pharmaceutical companies, those all impact certain areas of healthcare and services and treatment plans for different patients. And also like political changes in the market. For example, in US now, right after this recent election results, and the return of the Trump administration are likely to bring significant changes to the US healthcare system. In the industry, it's expected to have fewer regulations and more market-driven policies coming through. This means less federal oversight and more competition among healthcare providers. I mean, that will definitely impact the business side of the healthcare sector. Another area that might change is that there might be efforts to reduce funding for Medicare or Medicaid programs and introduce work requirements for Medicaid recipients, which could increase the number of uninsured people. The administration also aims to lower drug prices by increasing transparency and competition in the pharmaceutical industry. So, every administration, when they come in, obviously they make their changes, and those changes directly impact the operational and business side of the industry.
Well, it's definitely watch this space, isn't it, on the short term and the long term. I think it's a really exciting industry to be involved in, if that's the right word. But
Yep.
Good luck with the future, and I hope you. It'd be good to actually catch up and do another podcast, maybe in a year or a couple of years' time, and just see how things have progressed and whether what you're saying has actually happened and the changes have happened.
Absolutely.
But that would be really good to have me back and have you guys back. Right. Well, it's been lovely to see you. If somebody wants to talk to you, where can they get hold of you?
They can reach out to us or to me through our website. There's a portal where they can leave questions that we'll directly answer and contact them back, or on LinkedIn.
That's great. What about you, Antony?
Yeah, it's the same, through the website, or I'm sure that you'll have contact details on this podcast underneath. Happy to answer any questions. It doesn't have to be client related. It's just any brainstorming we find interesting in this space. So reach out if you need.
Good. Well, it's been great to see you. Thank you so much for today. It's been really interesting.